Jesse Jackson, the civil rights leader, receives a first dose of the Pfizer-BioNTech COVID-19 vaccine. The 79-year-old received his shot before cameras at the New Roseland Hospital on Chicago's far south side. This high-profile display was organized to address mistrust in minority communities and hesitancy to take the vaccine. Also in attendance, Kazmikia Corbett, an immunologist at the Vaccine Research Center at the National Institutes of Health and a lead scientist in the development of the Moderna vaccine.
Take the vaccination. Now. Keep hope. Alive. Keep hope. Alive. Dr. Corbett, you're number one.
According to one survey done in early December, just 24% of African Americans and 34% of Hispanics said they plan to get vaccinated.
It goes without saying that I'm a black woman, right? And there are few black women in the field, particularly as we move upper in the ranks of the field. But as we tackle vaccine hesitancy in communities, in minority communities, it's important for people to see my face and understand where I come from and where I sit in the development of these vaccines. And then also hopefully to reassure them that in so many ways I have their back.
This hospital has seen the worst of the pandemic. Its intensive care unit has been frequently overwhelmed with COVID-19 patients. But many of the frontline medical staff are themselves skeptical about taking the vaccine.
Corbett says another key element is making sure minority communities are given equal access to the vaccines.
There is absolutely so much that needs to be done in regards to just equitable health care in general, even if we take COVID-19 out of the picture.
One of the key public concerns about various vaccines is that they may have been rushed through approval. Corbett is quick to reassure no corners were cut.
It wasn't just that last year when this pandemic arose that we woke up and said, oh, let's go try something and let's go make this vaccine. It was saying, look, we have clear indication based on the knowledge that we had from prior epidemics, for example with MERS, which is another coronavirus, and let's make sure that we go very fast without compromising any integrity so that we can save lives at the end of the day, and that's what's happening.
In recent months, new variants of the virus have emerged, causing concern. Some appear to be more infectious. But Corbett says, according to the data, the vaccines appear effective.
As we're starting to test vaccine serum or the antibodies from people who have got vaccinated or animals that have been vaccinated, we're not really seeing any alarming data yet that suggests that the vaccines won't protect.
Since the pandemic began, the New Roseland Hospital has tested over 25,000 people, taking their testing on the road with a mobile facility. They want to do something similar with the vaccine, but first they must win over the doubters. Dan Williams, CGTN, Chicago.